Welcome back to the second segment of the interview. This time around, I'll be asking questions around the role of professional caregivers in nursing home and residential home. And one of the things that come to mind is, what qualities and skills make an excellent caregiver for the elderly? Because just as you said, this job is not for everybody.
Yeah, like I said, it's not for everybody. So it's strong focus in the compassion, dignity, and respect to our client. It's very important.
So compassion is the word.
Is a word.
Yes.
It's
Part
a
from
key
the training.
Yeah, part of training.
Good. So, what are some of the common challenges that a caregiver face in residential care setting, in a care home setting? What are some of the common challenges that your staff report to you that they face?
Yeah.
Or since you work in that sector before, what are the challenges?
Yeah, but the challenges we receive from our staff sometimes is a lack of communication. When they go to work in the care home, sometimes some care homes they don't give them the support plan to read. They send them so to go to support someone.
Because they know they just come in and they may not be. That's a good one.
Yeah, it's a big challenge we are facing sometimes.
And it's difficult for you to really understand how to work when you don't have the full picture.
Yeah, full picture. It's very important. Sometimes they go there, they don't give the risk assessment support plan. They say go to support A or B, C, D.
And when they make mistakes,
then they make mistake, then they fall, CEO, look what's happened for your staff. Then when you go to ask them the questions, they say, oh, sorry, next time, just remind us when you send our staff into the risk assessment and support plan.
That's very important. You want to emphasize on that?
I would like to say that, there's no proper handover, at the beginning of each shift.
Yeah.
You need to have a handover. And you need to know that the agency staff are not permanent in that place.
Yes.
They don't really know the resident very well.
Yes.
So every time before they start the shift, you need to give them a proper handover. Tell them who is who.
Yes.
So what they like, what they need, how they need to be supported to avoid the mistakes.
Instead of rushing them to do the
if
job.
you don't do that, anything can happen.
That's true. That's true. So it's very important for the staff, because they are agency workers, they are not permanent staff. They may not know the resident very well, or they know their needs and all that. So that's where the friction comes in. So some of your staff find that as a big challenge, apart from doing their job. That's good. So what advice will you give someone considering a career in adult social care?
To be honest, like I said before, it's not for anyone.
For everybody.
Everybody. So I will advise them to get a good heart and short, because they are going to face a lot of challenge.
To get a good one?
Heart.
They can't give what they don't have.
Yeah, they can't go there because they're very important. If you don't take a passion, please, it's not your job.
So you mean the approach to the job?
Center of approach.
Yes.
How you are going to deal with the situation, how you are going to support people. So I'm going to give them advice and some research. They need to do some research themselves as well, because you can't go in the field that you don't know how it works. Research is part of things you need to do before to apply these jobs. Go to do some research to do, if this happened, what can I do? What support I need to do is very important.
And also, if it is something they can continue with.
Yes.
That is self-development. Personal
self-development.
That's good. So, in that case, part of the orientation you give your staff, should it be, as you said, this is not a job for everyone. If they discover that is not a job for them.
See, if they discover that's not a job for them, it's better to leave it.
Good.
Why is not best to leave it? Because if you don't leave it, you are not going to promote people's life. Because our duty is to prevent bad things happen.
Yes.
To prevent harm, to prevent safeguarding issue. So if you know that you are not going to do it, it's better to leave it and do another job, because you are going to give people the wrong support.
That's it.
Yeah.
And also not to put yourself into trouble.
into trouble.
That's it.
Because you can lose your DBS. If you lost your DBS, it's going to be difficult to get a job. Because this job, we need to do the DBS.
All right, okay then. So, on this sector, I've asked you, the other question here is, as we said, this is a job that gets to you as a person, because I believe you have to be able to take care of yourself first, mentally, before you can look after others. So, what support is available for caregivers experiencing stress or burnout? What kind of support will you have for your staff?
Normally what we do in care service, there is a self-care as well.
Okay.
You need to look after yourself
Yes.
before you do the job. If you go problem, stress, you bring it up to the place of work, you're going to spoil everything. Look after yourself. If you feel like you can share the problem with somebody, share it. Explain it, but don't bring your problem
To the
or
job.
your stress at the place of work.
Yes.
Remember, you are dealing with vulnerable people. You need to protect these people and protect yourself. There's a two-way around. Look after yourself and look after those you are looking after.
That's it.
Yeah, because if you don't look after yourself, you cannot look after the one you are looking after. So self-care is really, really important. And as we said, this job is not just for money.
Yes.
It's not for everybody. You need to have compassion. That compassion, you need to take it as yours. Looking after vulnerable people is that you are looking after your own beloved one.
Yes.
Take them as yours.
That's the best.
Yeah, take them as yours, and you're going to have that heart to deliver the good care to those you are looking after.
Okay. So I'll round up by asking, because as you said, your staff that you send to the care home, the residential care home, they are not staff of that home. So because if they are staff of the home, every company may have, a different process, of attending to their own staff in terms of burnout and stress. So what provision do you have for your staff that are experiencing stress?
You have got counseling.
Yes.
So what we do, if you feel stress, and don't bring it like my colleague said to my place of work, because you're going to affect people.
Yes.
Even people with support, even yourself as well. So we need to do like CBT, cognitive behavior therapies.
Okay.
So we put in a place like counseling, one-to-one support. You can back here in the office, because we are full trained. Even when we did our degree at the University of Sunderland, we learned a lot. We had one module called counseling.
Yeah.
So how we can work our issue of plus away.
Yeah.
So we are going to give you some support how you can manage like we used to call it like risk management. So how to reduce this kind of risk. Next time when you go to place of work, this kind of things, if it's happened, you know how to deal with it.
All right. Thank you very much. We'll come back to the next episode. Thank you.